Happy Friday. I hope you are doing well wherever you are. So this week we are going to talk about mental health. I've been working on my health in terms of physical health. For those of you who don't know, I had a stroke 3 years ago. If you want to hear the story, you can go to my previous YouTube videos. If you're new here, consider subscribing. And few years I've been focusing on my physical health. But now I'm more concerned on my mental wellness and health. And I have some statistics here for you. And you can Wikipedia this, Google this. And it says almost 4 million Kenyans suffer from mental illness. I know what most of you think when I say mental illness. And yes, apart from it being schizophrenia, psychosis, it spans to depression, anxiety disorders, and it is okay to seek help. It is okay because of the stigma that we have when you go to a therapist and you are diagnosed with mental health. It's not all about psychosis and schizophrenia. A lot of our young people, especially here in Nairobi, have anxiety because of these gadgets. And it is okay to seek help. It is okay to seek therapy. I know some of people have bipolar, it can be genetics, but some of the causes for mental health is that I'll check here. There is no secret. Let me talk about stress. Of course, there's trauma. Like for me, it was traumatic. When I got a stroke, they say I had a blood clot in my brain, but I more believe there was some chemicals that mixed, that's just my belief, and paralyzed my left side of my body. But also it affected my brain. And especially the first 2 weeks, I was not myself. I could see animals at night chasing me like snakes. And I've shared this story here. You can go watch. And it's because of that traumatic experience that I went through because of stroke. Now, many people have mental health issues, not because of what I suffered, but because of stress. Life is stress, especially here in Nairobi. Because of less money. In fact, I have a statistics here that says almost 2 million people here in Nairobi live below $2. That's the extent of poverty we have. And even those who have money are also stressed. You have money, you can't sleep. You don't have money, you can't sleep because your stomach is empty. I know this is not a laughing matter, and we have to make life fun. Life is stressful. My encouragement to you is look for someone you can talk to. It is okay to talk to. In fact, I'm also doing therapy because of my. In fact, I started when I was in hospital. I started with seeing a psychiatrist. I would have never imagined my path. My path will cross with a psychiatrist, because in my mind, psychiatrists are for those people who are mad. Schizophrenia and all that. And I was one of those people because of stroke. I was seeing things. I was in, I think they call it olanzapine, all this psychiatric medication. Now I have been downgraded to a psychologist, so a therapist, so no medicine for me. And it is okay. It is totally fine. I have no issue with that. In fact, I'm enjoying it. I'm seeing her next week again. And taking care of your mental health is very key. So if you don't have the courage to see a psychologist or a psychiatrist like me, talk to a friend. Talk to a friend. Don't be isolated. share your issues, and be content. Be content with what you have. I know that's not what you want. There is more for you, yes. Even as you chase more, also learn to be content with what you have. It will give you peace. It will, and I'm trying that. I'm speaking to myself. I can actually see myself speaking to myself. Yeah, so that's my encouragement to you. I know life is hard, life is stressful. Take care of your mental health. We'll be talking about mental health a lot this month. So for today is just introducing it. I know you guys are seeing me laugh, but there's nothing funny about this. So anyway, if you are having mental issues, can be schizophrenia, can be bipolar, can be just normal depression, anxiety disorder, panic attacks, all those are forms of mental health. If you go to a psychiatrist, you'll be given medicine. Me, I didn't want medicine. So go talk to a therapist, psychologist, or better yet, talk to a friend, speak out, at least once a week, debrief with someone, share, just find connection. That's one of the ways to deal with this, but I'll be sharing with you more strategies of how can you overcome mental stress. And it's possible you may be going through mental wellness challenges and you have no idea. We'll be talking about that because unlike other physical illness where, for example, I was paralyzed on this side, you just look at me and you can see I am not well. But with mental, you cannot see. In some cases, you can see their behaviors is a bit funny, but in most cases, if you go to the streets of Nairobi, it's very hard for you to pinpoint who has mental issues, who is suffering from the mental health. So we'll be sharing with you how can you detect, and are you a candidate? Are you a candidate to focus on your mental health? See you next week. Enjoy your week. Have a restful week and take care. Bye-bye and God bless.